Hi everyone, Dr. David Kulla here with Synergy Wellness. So me and Denzel here, who's treating for costochondritis, we were having a great conversation and just bringing up topics that I think you viewers would want to know. And he was looking on a forum, which all of you with costochondritis are desperate for help because there's just not a lot of great help, no tests to show that you have it. And he was reading on a forum about people doing cryotherapy. So the topic of this video is cryotherapy for costochondritis. Is it helpful? And you said that you read on the forum that a lot of people had some benefit from it and helped.
Yeah.
So I want to go into that a little bit and why that would be. So what is cryotherapy? Cryotherapy it reduces inflammation. It's an analgesic. So it blocks pain and reduces inflammation. But cryotherapy has some other sometimes unintended side effects. So while the cryotherapy is just going to reduce inflammation, but it's going to be the whole body because I think you're jumping in a tub, right? So, you got to deal with cold all over. That's going to numb up the pain. And it's also going to reduce the inflammation. For those of you that have mild costochondritis and you want to try that, maybe it works. Great. But I warn you, in the beginning it may work, but later it may get worse because cryotherapy causes muscles to tighten and shorten. That's the last thing you need for costochondritis because when you tighten and shorten those muscles, you're going to make that worse in the long run. It's probably going to come back. If you have a severe case and you're in so much pain, the cryotherapy will reduce the pain and will reduce the inflammation and initially may reduce a lot of your bad, heavy, nasty symptoms. That's okay. But please, if you're going to do cryotherapy for costochondritis, make sure you do the stretches because it's going to shorten the muscles again. So with him, before we adjust our costochondritis, not just him, but our costo patients, we put ice on the chest to reduce the inflammation in the chest wall. I do realize it's going to tighten the chest muscles up. So we do stretches for the chest afterwards or laser. We'll talk about that in a second. But you want to make sure if you're doing cryotherapy for pain and it helps, great, awesome. Make sure you're doing costochondritis stretches. I did a really awesome video, 3 of my favorite stretches for costochondritis or 3 best exercises for costochondritis. And check that out and that'll get you started. Do that before and after your cryotherapy session. Now, what I like better than cryotherapy is cold laser therapy. Cold laser therapy comes in all different shapes and sizes. And there are a lot of cheap lasers out there on Amazon. I'm not telling you to buy one of those. Those are not real lasers, okay? Just beware. It's not like a laser pen where you shine it and your cat chases after it. It's not the same laser, okay? This cost me $15,000. If it was that cheap, I would have bought a little laser for my cat or would have brought it in here and treated patients, okay? So this video is not about what laser you should buy, but I will tell you this, laser reduces inflammation so much quicker than ice or cryotherapy. The other advantage of laser is it will reduce inflammation, it'll reduce muscle spasms, whereas cryotherapy reduces inflammation, pain, and increases muscle tension. Laser reduces muscle spasms, reduces pain, and reduces inflammation, all the benefits that you want. So this is far superior and it can penetrate deeper into the tissue than cryotherapy. And how long do people do cryotherapy for, do you know?
Someone mentioned 3 to 4 sessions before they felt better.
So like 3 sessions of like a minute or 3 minutes. Yeah, so again, I hope that helps you. If you're thinking about cryotherapy, it may help you if you're in so much pain, and I'm not knocking it, do it. But just please do the stretches after you do the cryotherapy. Include some stretching in the back here, which I go over that in my video, and really make sure you're doing that with the cryotherapy. And that may be the perfect mix for many of you to get through this. But most of you will need to see a chiropractor, do the stretches on your own, and for the severe cases, adding cold laser therapy is huge. This is a game changer. This fixes things very fast, probably about 50% faster than anything else will. Okay, so I hope that helps you folks that are considering cryotherapy, and I hope that now you understand what cryotherapy is and how it can benefit and how it can make costochondritis worse. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.